Yeah, my name is Bob Eberhart. I'm an orthopedic surgeon at Atlantic Orthopaedics and Sports Medicine. I was one of the three original founders of the practice back in 1987 when we were on the Route 1 bypass. We do so many more things now, endoscopically, with fiber optic instruments, with smaller incisions, so the trend has definitely been towards less invasive surgical techniques, which in most cases leads to less patient discomfort, quicker recovery times. So as orthopedic surgeons, all the doctors in our practice are board certified. And then in addition to that, you can then go on and take subspecialty, essentially board examinations. So I have what's called a certificate of added qualification in hand surgery. I've spent a lot of time over the years also doing a fair amount of sports medicine, covering various teams in the area, and also I've done quite a bit of joint replacement as well. But as time has gone on, I've focused more and more of my practice on upper extremity and hand surgery. Despite a small anatomic area, there's a tremendous amount of anatomic complexity in the hand and a lot of delicacy that's required handling the soft tissue. So it's technically a very demanding subspecialty in orthopedics. I love the anatomy, I like the problems, I like the surgical solutions. I see people who come in with bad lacerations from the emergency room with tendon and nerve injuries. More often I'll see people with acquired degenerative conditions in their wrists and their hands. And those have a variety of different surgical solutions. We now have more or better ways of dealing with wrist fractures. It used to be sort of a push it together and hope for the best, and now we have some very precise ways of putting those fractures back together again. I like boating a lot. I have a boat, and I have a lobster boat, and I have a fishing boat, so I spend a lot of time on those in the summer. I just do it for fun. I have 30 traps, but that takes a lot of work. I'm always amazed that these guys can do that for a living. It's unbelievably hard work, but it's fun. I love being out on the water, and it gives me a task to do. There's a beginning and an end to lobstering. You have your traps, and once you're finished, you're done. I really get a lot of enjoyment out of learning about my patients and getting to know them. Where they live, what they do, and it's amazing to me how many people have interesting things in their lives that you may never have thought about. But I like getting to know the people as well as the variety of interesting problems that I hopefully help them deal with.